Hey y'all, happy weekend, happy Sunday, checking in. Just a quick check-in because I don't really have a lot going on right now other than a few side effects from the letrozole or the Lupron or both of them, I don't know. Started those little over 2 weeks ago, July 1st and July 2nd. I got the injection on that Wednesday and started the letrozole the next morning. And so I've been recording, which I highly suggest my warriors do that as well, who have to be on these meds. This is endocrine therapy, Lupron injections for ovarian suppression, and I am on letrozole. There's 3 different aromatase inhibitors, and my doctor started me on letrozole to see how I do with the side effects. I can always switch to another one if I feel like the side effects aren't manageable. So far they are. So I don't really know if there's side effects from the Lupron because I was already menopausal before starting that. So I think maybe anything I'm experiencing, I would venture to say is from the letrozole. But I am keeping a daily log, and I do suggest you do that. I guess the main things have been headaches, but not severe, manageable with my regular, I take a dual action pain reliever over the counter, great value. It's like acetaminophen and ibuprofen combo. So when it gets, like, hey, I'm trying to work and I can't deal with this headache kind of thing, I'll take those. That seems to do the trick. Okay, hot flashes did step up a little bit. However, I was already on, for some reason I want to say Lexapro. It's not Lexapro. I'll get back to you on that one. It's Effexor. Brain fog. That's one of the side effects. It comes and goes. That hasn't been too bad, but I was already on that to kind of mitigate the hot flashes from when I stopped my HRT back in February. So that definitely cuts the intensity and cuts the duration of the hot flashes. I guess I get cold flashes too. I still get those. I got those 3 years ago, and I'm getting those again. So I alternate. I'll be like, it feels like I'm in the desert and I can't get out. And then the next like 60 seconds, that'll last like 10 seconds. And then next thing you know, I'm going, it's freezing in here. I feel like I'm on top of an igloo naked. So it's all over the place. But again, it's manageable. And I just laugh through it. And what else? Headaches, joint pain. Yeah, I already was dealing with joint pain because I have autoimmune issues, but that had gotten a lot better after I went on my GLP-1. I mean, like 95% better. And I'm at a very lean weight right now, so the joint pain's not too bad. Again, manageable. Only 2.5 weeks in-ish, so we'll see. The side effects are supposed to peak around 3 months, so I'm thinking I'm going to be on these meds. I'm supposed to be on them at least 5 years, so hopefully I can manage side effects and get through it. Other than that, I'm healed completely from radiation. You cannot even tell on any of the areas that I even had it, so that's good. I go for my follow-up at the end of the month, and I mean, I can't really complain, and I just want to keep making videos and keep giving updates along the way, because things may change. I'm going to be seeing my surgical oncologist in a few months, my radiation oncologist for a follow-up, my reconstruction surgeon, and I'll be seeing my medical oncologist to monitor my side effects, the whole thing. One thing I do want to mention too before I sign off, I had told you guys a while back that I was going to be doing a Kisqali trial. It's a 3-year trial with this drug, and it was originally designed for women with metastatic breast cancer, but they're finding that it's extremely helpful for women in early stages of breast cancer. So my medical oncologist wanted me to do that. I have decided not to do that trial. I had to weigh the risks versus the benefits, And there would be, you have to have a baseline EKG done. You have to have liver testing done to monitor liver enzymes, kidneys. It can be hard on all the organs, and I don't right now need anything additional other than the endocrine therapy that I'm going to be taking for 5 to 10 years. Thinking 5, but you have to consider your quality of life as well. And for me, if it was a higher percentage, if my Oncotype score had come in higher or something, but for me, it's a no-go. So I have to have that conversation with my oncologist next week. He's not going to be happy about that, but anyway, so shoot me some questions. I do have some friends who are dealing with some things right now, family members dealing with their own stuff. Always feel free to message me. You don't have to put it in the comments or anything. I get DMs all the time, so message me any questions or any way I can help you out. Offer my advice, my wisdom, my experience, anything. I'm here for you, my warriors. All right, y'all. Love you.